Hi, I am Dr. Indranil Ghosh. I am a consultant medical oncologist at Apollo Clinical Hospitals, Kolkata. Today I have come to you to share something about lung cancer. Lung cancer is a very dreadful disease. Many of us have seen somebody in the family or in the friend circle who has died of lung cancer because it's a very dreadful disease. What is lung cancer? Lung cancer is because of some cells in the lung which are growing at an abnormal pace and have formed a tumor which has the ability to spread to other parts of the body and even cause death of the patient. Now, why is it so dreadful? Because many a times we are not able to detect it at an early stage. Most of the time patient comes at a later stage where the disease has spread a bit. Now, at that stage the treatment usually becomes incurable. But fortunately, lung cancer is one cancer which can be prevented because 80 to 90% of lung cancer is because of smoking, either cigarette smoking and in our country especially bidi smoking. Now, if we can control smoking, then 80 to 90% of our lung cancer cases will not happen. Now, that is a big deal because lung cancer is the most common cancer in our country in the male population and also one of the most common in the female population. Now, if we can control the most common cancer in the male population, that will be a very big thing. So, first of all, before going into lung cancer, you should understand that lung cancer is better prevented. Anybody in your family, in your friend circle, anybody who is smoking, you must encourage them to quit it immediately. Because even a person who is smoking now, if he quits, it will take 5 years, 10 years to get the risk normalized. After that, after maybe 10 years, the risk will be normal. The risk will be that of a normal person who has not smoked. A person who is smoking, say 1 pack per day of cigarettes, has a 20 to 25 times higher chance of having lung cancer than a person who has not smoked. Now, in our country, the problem is that smoking starts very early, in the teens or maybe in the college years. So our next generation has to be targeted so that we can prevent smoking in them and in the end reduce the lung cancer epidemic in India. In the West, already lung cancer incidence is reducing, but in India it is still increasing. That was for prevention. Now coming to the signs and symptoms. Suppose a person who is smoking or even in non-smoker, because non-smokers can also have lung cancer, but it is only around 10% of all the lung cancer. Now, what are the signs and symptoms with which we will suspect the patient to be having lung cancer? Number one, any persistent cough which is not improving with routine therapy. That is already say 2 weeks or 3 weeks has gone, but the cough is not improving. Any blood in the cough, there is a sputum which is coming, is blood stain. Any difficulty in breathing, a pain in the chest, any swelling in the neck. These are the common signs and symptoms. But if the patient is having an advanced disease, he or she may have other symptoms. Like for example, the disease has spread to the liver, the patient may have abdominal pain, loss of appetite, weight loss. The disease may spread to the bones where it may give rise to pain in the back or pain in any bone or any bones of the body. Or if the disease can even spread to the brain, where the patient can present, sometimes patient does not have symptoms in the lung, but patient presents with headache and vomiting or convulsion and finally diagnosed to be a lung cancer which is spread to the brain. So these are in advanced stages. Now suppose a patient comes to, a patient has a cough and blood in the cough and comes to the doctor. Then the next question is how the diagnosis will be made, how the doctor will think that the patient has lung cancer. Usually, first of all, a chest radiograph is done, X-ray of the chest. If it suggests some tumor, then usually CT scans or whole body PET CT, that is positron emission tomography scans are done, which not only suggests the diagnosis but also the stage of the disease, which is also very, very important. Now, this CT scan and PET scan can suggest the diagnosis and say the stage, but they cannot give the final diagnosis. For that, we need to do a biopsy from the tumor. This biopsy is usually may be done either through a CT guided by a needle, which the radiologist puts under CT scan guidance into the tumor and takes the cells out. Another type of biopsy is through the bronchoscope, where a camera-like thing goes into the air pipe in our main air pipe, and through that the doctor looks for the tumor and takes biopsy directly from them. Which biopsy will be required for which patient, that depends on the location of the tumor and the type of the tumor. Now suppose a patient, now we have confirmed the diagnosis is lung cancer. Then there are many treatment options: surgery, radiotherapy, chemotherapy, targeted therapy. Now sometimes the patient can get confused. So usually what we follow is a multidisciplinary treatment. The patients are seen by surgical oncologist or thoracic oncologist who does the surgery, the radiation oncologist who gives the radiation therapy, that is a type of X-rays which penetrate inside the lung and can treat the tumor, and the medical oncologist who gives the chemotherapy, that is injection medicines given through injections which help kill the tumor. All these specialties sit together and decide which treatment will be best for the patient. If it is a small tumor and does not spread anywhere, then surgery is the best treatment, which may be followed by radiation and chemotherapy. Or if the patient is unfit to go for surgery, because patients may have smoked for many years and their lung condition otherwise is also not good, those patients may not go for surgery. In those cases, radiotherapy or radiation therapy is given. Suppose the disease has spread a bit further. There is a tumor in the lung, as also there are many glands in the central part of the chest. Those glands have involved in the PET CT scan. Then usually surgery is not done. Radiotherapy along with chemotherapy is the usual treatment. Now a further stage, the disease has spread elsewhere, spread to the liver or bones or any other part of the body. In that case, surgery and radiotherapy is usually not done. Chemotherapy is the usual treatment, and we also have a newer type of therapy, and that is targeted therapy, which targets only the cancer cells. These are usually given in the form of tablets, which the patient takes at home daily, and they can target the tumor and reduce the tumor burden and help the patient in reducing the symptoms and extend the life. Usually for this, some special tests are done in the biopsy, and if those tests are suggestive of benefit by this oral therapy, then these therapies are given. They have less side effects as compared to chemotherapy. Now again the question will come that after treatment, suppose the patient has completed surgery and chemotherapy and radiotherapy as appropriate, now what to do? Now also the patient will have to be under regular lifelong follow-up, because even in early stage lung cancer, the disease may sometimes come back. So we need to keep the patient under regular follow-up. Take sometimes CT scans or PET scans are done at routine intervals to see if the disease is under control. If it is not, then we need to do some other kind of treatment. Now another question will come that suppose a patient has done smoking. Suppose a patient is now 50 years old or 60 years old and has smoked since the age of 20 years or 30 years, maybe one or two packs per day. Now this patient is at a high risk of having lung cancer. Can we do something to detect it at a very early stage so that it can be cured? The answer is yes. There are some methods. Previously people used to do X-rays, but they did not help. So now we have a method called screening CT scans. A CT scan, that is a computed tomography scan, which is an advanced form of scanning of the lungs, can be done, which are very low dose and can be done yearly. And if there is something, any suspicious thing, then we can do further workup, like we can do the biopsy or needle aspiration to confirm the diagnosis. If there is nothing, then we can do again a scan next year. By this way, even in high risk population, we may be able to detect lung cancer early. But still the bottom line is in lung cancer is prevention is always better than cure, and hence smoking should be avoided by everybody, and even those who have started smoking should start quitting it as early as possible. Quitting obviously is not easy, so we have some medicines which we can give, or even psychological support counseling sessions can be arranged, by which we can help the person to quit smoking easily. Thank you.